My dear, you're welcome to Confessions on TV3.
Thank you, Miss Nancy.
Please share your story, your confession.
Miss Nancy, I've been married to my husband for 11 years. We have 2 children together.
Okay.
At 45, I still look young for my age.
Of course.
Some even say I'm still beautiful.
45 is the new 20, you know.
Miss Nancy,
Yes.
but behind the smiles, people see is a life filled with loneliness and exhaustion.
Oh,
5 years ago, my husband suffered a stroke.
okay.
Since then, my life has completely changed. He can no longer speak to me or do anything for himself. We used to live abroad. From that time till now, when we came down to Ghana, was hoping that the family could even help. But no one.
Oh,
We have 2 kids. I work so hard to take care of my husband. You know, paying even hospital bills is not a joke, Miss Nancy. The family has abandoned us. I can't even go out with friends to even have fun, as young as I look. My days are the same work. Like, Miss Nancy, I'm fed up. I'm tired. See, Miss Nancy, I wish men are approaching me. Now I'm lonely, spiritually, emotionally. I don't even have anyone to talk to because he's like, I don't know, a dead bed.
oh,
When he has to poo-poo, I'm the one to clean him up. Maybe on himself, I'm the same person to clean him up. I'm breaking down, Miss Nancy. Men are approaching me now. I don't know. I feel lonely. Now I've decided that I want to, go in for someone who would at least be there for me, comfort me, and pamper me. We are almost in February, Valentine. Who will even get me a gift?
oh,
My friends will be receiving gifts, surprises, but I will still be cleaning up. And I'll be taking my husband to the hospital and all that. Nancy, I can't take it anymore. That's why I brought it here, because I want to move on. I want to move on.
I'm so sorry. So sorry for this experience. That's quite a confession, quite a story. Even listening to her, you could see from my face that it's a deep one. Let's get into the studio. I need more deeper heads than mine to make a conversation out of this. We really need to talk about the situation and find a solution for our dear sister who is a committed wife, but she says she's overwhelmed with life at the moment. A sick husband, 2 children, she's the breadwinner, and she needs some tender, loving care herself. She needs comfort. And she's right in needing these things. She's only human. Most of the time, people go through things and we do not know how to help them. Tonight, there is a young lady. She's a psychologist and a very intelligent one. Boma joins us to tell us what... Ophelia is coming on the show to give us knowledge about what the person that is caring for the sick one also goes through. Ladies and... let's make her feel more love. Ophelia is my beautiful doctor, and she comes from my new church. The Deeper Life Christian Church is my new church.
Wow,
and
nice.
my regards to the founder and his wife and all the leaders of the church. It was a great time I had with them last year.
Yeah.
And Deeper for frame. And I'm going to honor frame. And I was sorry, no guy. Ophelia, you are the one that works with the minds of people. Can you explain to us what this woman is going through and if it's valid for her to feel the way she's feeling with the situation.
Okay. Good evening, everyone.
Good
Miss
evening.
Nancy, you look so lovely, always.
Thank you. Thank you. So are you?
Yes. So I would like to first of all educate the populace about caregiver burnout. Okay. So caregiver burnout is the fatigue patients, caregivers go through by taking care of them. An example is for chronic illnesses like stroke, cancer, diabetes, hypertension, always having to remind them to take their medications and then their diet to take.
It can have an effect on the caregiver,
yes.
the one taking care of
yes.
them. Does it happen to the professionals as well?
Of
the
course.
doctors and the nurses?
Yes, we do.
They also go through that?
So we also go through therapy.
Na onu a woye ne enye ne busuani no no.
Yes.
Wow.
Yes. And so a lot of times, because I used to work in the hospital, I used to offer counseling to the patient and their caregiver. So we psychoeducate them about the disease or the illnesses, how to care for them, how to seek and ask for support, right? So a lot of people do not or cannot ask for support because of the moral injury or maybe external heresies about what they may go through. An example for this woman, okay, some may say, that is your husband. You are supposed to buy and buy. Stick to her. Stick to him. But we need to understand that there's grieving. Okay, I have taken care of a cancer patient, right? Every day I go to him and I see him failing. Like life is leaving his body day after day. So you are grieving in the process in real time, right? So it's not as if it's after the person is gone and buried
that you
and you will have you grieve through the process. And as a young woman, she grieves her identity.
Of
like
course.
Who was I before this survival mode, before you know, separating myself as a mother, a caregiver, and having to look at myself in the mirror. What do I see about myself? Do I like my appearance now? Do I look fit and put together? And also the burden of childcare, parenting.
Easy.
That alone, you see. And so I would like to encourage people to understand what caregiver burnout is, and then to just offer them the help and the support needed when they ask for it. And even if they don't, give them a helping hand to be able to also take a rest, right? And for the attachment, you see, when we talk of companionship, we are social beings, right? And in every human development, there are stages. The stages that come with emotional needs, the stages that come with safety, understanding who you are, your identity, your role, expectation versus the reality of, you know, the situation. So for her seeking for attachment is because it's a human need. And at a point in your life, you would also want to feel seen, understood, loved and touched, listened to. And this is all love for her. And so as a clinical psychologist and also someone who understands faith, that faith comes with mercy, right? God also asks that we should rest because it's a moral or a spiritual commandment
that she needs rest.
She needs rest. So we can't just rule that out and judge her and try to say all negative things about her.
So you see that your brother that got sick, when his wife had to leave him to go on a vacation, you see how you were criticizing the person because you did not have this knowledge. Confessions is a great program. Let's celebrate confessions. Ophelia, the professional view for a person who is burnt out, as you explained, what are some of the things that she can do to recoup, to keep herself alive, as we are saying? And now I don't need you to speak as a Christian, I need you to speak as a psychologist.
Yes, definitely. I normally
disassociate
myself.
Indeed, when I trust that.
You meet a whole lot of people. How about people who are atheists? I've cancelled gay, lesbians, you know, all kinds of people, and just doing my work as a professional, right? So in situations like this, there are a lot of therapies we use. So we can use narrative therapy.
Narrative?
Yes.
So she coming here was therapeutic?
Yes, like
great.
sharing the story, letting her emotional needs be heard and understood, right? And also to validate her. Oh, you've done well. You know, what support do you need? And we also have what we call compassion therapy, like self-preservation. To her, what is love? Right? Should we go back to define what love meant to her before she found herself in this situation? Except that when she looks at herself like 5-10 years to come, what will she be proud of herself? So then you go into the value-based. Now we have the faith integrative therapy, where you add other forms of therapy with faith. I'm sure Mama Kati will do that. So now you assess her values, her morality, her personality, why she has come to understand who she is. When we talk about moral injuries and all of that, is she okay to take this step? Now, at this point, we don't advise. Whatever she decides to do, we support her. We just show her the way. And the Bible says what? Lack of ignorance? Lack of knowledge make my people perish. So you offer her the opportunities, the options available so that she can make her own choice. Yes. So when that is being done, then you support her to go through it, because definitely there may be risk she will take. So what does it mean to allow herself go through this form of risk?
Let's talk about this whole challenge she's going through with her husband and the effect on her as a mother, parenting children with a sick father.
Okay, so in instances like this, it will look as if the father is absent, right?
Yes.
And an absent father offers children not so much, right? Because I've come to understand that children who have grown up with chronic ill parent are either more super empathic or very aggressive, right? Because both families, both parents were not there to make the decisions. They only had the decisions from the mother's side. All they did was just to support. And this could even be a burden to the firstborn or second-born child. So they become second parent. And this follows them to their adulthood, into their own marriages, where they take the back seat and may live in just survival mode, as in live for others, whilst they repress emotions and not express when there's a need to. And it's a whole lot. So an absent father or mother is more of a psychological burden to the children. So when this, when it's a situation like this, you get a father figure, either an uncle or a bigger brother or a pastor, like someone that can help to bring up the children like a father would do, not someone who will come in and molest them. You know, sometimes when there's an absent parent, someone can use that and abuse them or molest them. So I would just admonish that you find someone who is willing to step in as a father or a bigger brother to help the kids grow.
This is Confessions on TV3. Thank you very much, Ophelia. We will take this break. When we come back, more. Welcome. It's a very, very deep conversation we're having here. And Ophelia Boma, our psychologist, has just said that at this point, we would give the options to the woman for her to choose the best way to survive this very challenging time of her life. Thank you. That was very insightful.